Good afternoon, everyone, and welcome to the September 2025 edition of the SYNLAB Nigeria webinar. My name is Uchenna Amadi, and I'll be your host for this session. Our topic today is Understanding Her, a Holistic Approach to Women's Health. Before we dive in, let me briefly introduce SYNLAB Nigeria. SYNLAB Nigeria is a leader in medical laboratory services and has been delivering world-class diagnostics in Nigeria since 2004, revolutionizing the way medical professionals support patients and bringing high-quality healthcare services to families across the nation. We offer a comprehensive range of laboratory tests designed to meet the diverse needs of both patients and industry, ensuring accurate, reliable, and timely results. At SYNLAB, we remain committed to excellence and innovation. Today's conversation is such an important one because women's health goes far beyond treating symptoms. It is about caring for the whole person, her physical, emotional, hormonal, and mental wellness. So whether you're a healthcare professional, a caregiver, or simply passionate about women's health, this session is for you. We are honored to have with us here, two esteemed guest speakers who will be sharing their expertise. I encourage you to stay engaged, take notes, and share your questions during the Q&A session towards the end. You can do that by putting your questions in the comment box. So without further ado, let's get started. Our first speaker is Dr. Jolayemi Waliyat, who is a dedicated gynecologist with a deep passion for women's health. She's a graduate of University of Ibadan. In 2018, she became a fellow of both the West African College of Surgeons and the National Postgraduate Medical College of Nigeria in obstetrics and gynecology. She also holds a master's degree in public health. Dr. Waliyat has practiced extensively, both locally and internationally, with a special interest in gynecologic oncology, particularly in raising awareness about cervical cancer screening and prevention. Beyond her clinical work, she has contributed to medical literature, authored books, published articles, and shared her expertise at national and international conferences. Away from medicine, she cherishes her role as a daughter, wife, and mother to her lovely family. Please join me in welcoming Dr. Jolayemi Waliyat.
Thank you so much for having me on board.
Hi, Dr. Joy. Please proceed.
I'm trying to share my video.
Okay.
Yeah. Good evening, everyone, or good afternoon, everyone, wherever you are. Like the host rightly said, I'm Dr. Jolayemi Waliyat, and I'll be talking about, the aspects of hormonal, understanding your body as a woman from between the age of 20 to 40s, and everything we need to know as being a woman. Please, can you help me share my slides so we proceed? Can you share my slide, please? Okay, thank you so much once again. So, understanding fertility, hormones, and your health in your 20s to 40s. Being a woman, whatever we are, actually start from when we are inside the womb of our mothers. So, when a girl child is formed, a girl child, can you go to the next slide? But I will keep talking. Yeah, I will go through this outline. I will briefly introduce how we can understand our body as a woman. Then I will take us through the menstrual cycle. And there are some reproductive issues that usually go unnoticed. I would share with us the reason why this could be. The importance of fertility awareness would equally be touched briefly. There are some cases of hormonal imbalance, different causes of hormonal imbalance, but we're going to, talk about some of the causes of hormonal imbalance so we can know who to call for help. I would equally take us through the importance of diagnostic tools, and then I will end my session by concluding on this topic. The next slide, please. Okay, so I've put here that this session is to enlighten ourselves. It's not going to be like giving us lecture. We're just basically going to enlighten ourselves on how to understand our body as a woman or as women, and ensure that our bodies are constantly looked after so that we can achieve optimum health to keep healthy all the time. The next slide, please. So this here is just a picture of what the female internal organs looks like. Okay, before I talk about this diagram, I would let us understand, like I was saying before we started, that a girl child being a girl child has actually been determined right from inside the womb of our mothers. When the sperm meets with the egg, there are some proteins we call chromosome. So the X chromosome from the male, usually a male has two chromosomes, the one pair, the X and the Y. To form a girl child, the X of the husband would have to meet with the X of the woman. Woman generally we have a pair of two X. Okay, so one X from the man will meet with one X from the woman to form a girl child. And as soon as a girl child is formed, at around 5th month of pregnancy, what we're going to use for any average girl, what she's going to need to carry out through her reproductive organ has already been determined at that point. So at about 5 months in our mother's womb, we have up to like 7 million eggs that we have in there. And that would continue to reduce in number till a girl child is given birth to at term, usually at 9 months. For layman understanding, at 37 weeks there upward. So at birth, this drastically reduced from 7 million to 2 million. And it is this 2 million that will continue until the girl child starts the period of puberty, which usually can be from the age of 8 years and above. So a girl child can start a pubertal changes from 8, 9 years. And from the time it became 2 million at birth, it reduced drastically to between 300 to 500,000. Now, I hope we're still together. If you can hear me, please let me know.
Yes, please. We're together.
Okay, thank you so much. So at the pubertal stage, it reduced to between 300 to 500,000. And this is what a woman or a mature girl will carry till she gets to menopausal stage. So at monthly interval, the different eggs will be recruited, and only one, rarely we have like two, releasing the content. We'll talk about that subsequently. So the female reproductive organ is divided into two. We have the internal part of the reproductive organ and the external. So this diagram here is showing us the internal reproductive organ. We have here the uterus, the lining of the uterus. We have the ovaries, which is a paired organ, one on the left, one on the right. Equally, we have two fallopian tubes, one on the right, one on the left, and then the cervix and the vagina. So all these would undergo different changes, be it hormonal changes, be it physical changes, as the girl child continues to develop. Please, the next slide. Okay, so the function of all these that I've been talking about are being regulated by what we call the hormonal system. There are different hormones in the body, both male and female, but we're going to be dwelling on the female hormone. So to ensure proper body function for parts and organs of the body, they must communicate with each other. And specifically, we have the higher center, which is the brain, that coordinates all this function. So, and the way they do that is to make sure that we constantly have the internal environment maintained, what we call homeostasis in medical terms. So the hormones are just basically molecules which mediate powerful signals, and these signals coordinate different bodily functions. They carry messages from different parts of the body through the blood to various organs. They are essential to life and health of individuals. Like I said, we have different types of hormone that regulate body functions ranging from growth, development, metabolism, and every other thing, inclusive of the reproductive function, to mention but a few. So we'll be looking at the different hormone subsequently. The next slide, please. So this schematic diagram is just to tell us the hormones that is needed for female reproductive function. Remember I said we have the brain that controls all the other body organs. So in the brain, we have two parts that deals with this hormone. We have the hypothalamus, which is in the brain, and then we have the pituitary gland, which is at the base of the brain. So these two organs, these two parts of the brain are the ones that secrete hormone that would regulate the reproductive organs. So when you have different complaints and you are being asked to do some investigation that has to deal with, imaging your brain and doing tests to check whatever is wrong, don't be taken aback or don't be surprised that I'm complaining about hormonal imbalance. What is the concern of hormonal imbalance with them asking me to go and do imaging of my brain? They are related because part of the brain is what regulates the reproductive function. So in the brain, we have the secretion of hormones such as what we call the follicle stimulating hormone, the FSH, the luteinizing hormone, and the other hormones that are in there. All these hormones that you see on the slide are very important for regulating the reproductive function. And the major ones are the FSH, the LH, the progesterone, the estrogen, and testosterone. Testosterone are equally produced by female organs. You would be wondering that what is the concern of female with testosterone? Yeah, some parts of our body actually, can convert fats and every other thing and some hormone to testosterone because it is equally needed for our body function, though in small amounts. Testosterone is a major hormone for the male, but we equally need it, especially when it comes to some cases of hormonal imbalance like polycystic ovarian syndrome. Testosterone is one hormone that we assay for when we are suspecting that a woman could have polycystic ovarian syndrome before we'd go ahead in advising the different options of management. The thyroid hormone is equally very important in regulating body metabolism and reproductive function of a woman because, like I said, hormonal imbalance, if there is any disorder or any problem with the thyroid gland, it could come as a result of hormonal imbalance, either hyperfunctioning or underfunctioning of the thyroid gland could present in so many ways that would affect the reproductive function. The next slide, please. Yeah, now I would just briefly talk about the menstrual cycle so that we can understand who we are as women. The menstrual cycle is what is like a sequence of coordinated natural changes in the hormonal and the structural parts of the ovary and the uterus. These are the two parts of the female reproductive organ that are needed in, in the menstrual cycle. And these are regulated by hormones, like I said, by both the hypothalamus, which is in the brain, and the pituitary. I believe I've touched it a bit. The menstrual cycle comprises of the ovarian cycle and the uterine cycle. And these two cycles occur concurrently. They go hand in hand. One involves the production and release of eggs, while the other one involves the secretion of hormones, which prepare the female parts either in preparation for pregnancy, or if fertilization does not occur, then a woman will see her menses nest. It's the estrogen and progesterone prepare and maintain the lining of the womb, and in readiness to receive and accept the fertilized egg that we call embryo. The next slide. And this menstrual cycle, it has average duration. It normally lasts between 21 to 35 days, with an average days of 28 in population, So it is not, sometimes I get people that will say, because my menstrual cycle is not 28 days, it is abnormal. It is not. The normal actually ranges from 21 to 35. The 28 is just when they take sample of the population, the average of that duration that lies with 28. So if your menstrual cycle run for 21 days, you are still normal. And if it runs for 35 days, it is still normal. So it is anything outside this range that we say it is an abnormal menstrual cycle. And this menstrual cycle is actually a significant indicator of hormonal health. So you can know, or you can tell, when something is going wrong with your hormonal system. It will reflect on the menstrual cycle. The first menstruation that a girl child will ever have in her life is called menarche. That is the first menses, and it starts at puberty. It starts around the age of 9 or above, but it shouldn't be later than 14 years when you don't have any other secondary sexual characteristics. What do I mean by other secondary sexual characteristics? Like a girl child having the pubic hair, having the axillary hair, the growing breast, and growth spots, the girl child growing taller than what she used to be. If in the absence of all this, she hasn't menstruated by age 14, then you should seek for help. And if by age 16, in the presence of these secondary sexual characteristics, a girl child hasn't started menstruating, then it calls for concern. Then you should go out for that child to be evaluated. The end of the menstrual cycle usually marks the onset of menopause. So when you stop menstruating, and this has been ongoing for 12 consecutive months, then we say such person has reached the age of menopause. And it's just simply put, it means that virtually all the eggs have been exhausted. Remember, I said when the number of eggs that is going to carry you through your reproductive career has actually been determined from the time you were being formed in your mother's womb. And it's from month to month, a whole lot of them are recruited, and just one will get ovulated. Rarely, we have 2 or 3, but it's not that common. So when you've exhausted all the eggs and the hormone hits the lowest level, because it's the ovary that secretes the hormone that regulates that function, the progesterone and the estrogen. So when they reach the lowest level, then we say a woman has reached the age of menopause. The next slide, please. Are we still together? Okay, so this pictorial, this graph is just to show to us what I've been saying all through, that the menstrual cycle ranges from, with an average days of 28 days. So the menstrual cycle involves the ovarian cycle, which is the one here, the uterine cycle, which is the one that is being represented by the pictorial diagram of the uterus here. And then this cycle are divided into phases. For the ovarian, we have the follicular phase when you start. Well, the first one is the menstrual phase, when the lining of the womb gets shed if there is no fertilization of the egg that was released at the mid-cycle. Usually, this one lasts for a period of 1 to 7 days with an average of 3 to 5. So if you menstruate for just 1 day, you are normal. And if your own menses last through 7 days, you are still normal. And if it lies in between, it is normal. So from the menstrual phase, you get to the follicular phase when new eggs are being recruited, when new follicles are being recruited in preparation for ovulation at the middle of the cycle. And usually in a 28 days cycle, you get ovulation at day 14, which is the mid cycle. So this follicular phase is the one that varies in everybody. Why this luteal phase is constant in all women, irrespective of the duration of their menstrual cycle. So the last 14 days, which constitute the luteal phase, is constant. So for you, this equally helps you when you're determining your ovulation time or your fertile period. So understanding the menstrual cycle is not all about bloodshed only. Neither is it all about pregnancy only. You can equally use it to as contraception. You know, if you don't want to get pregnant, the period that you know from your regular cycle, you know that, okay, my cycle length varies from 28 to 30. And understanding the fact that the luteal phase, which is the last 14 days, is constant in everybody. You just remove 14 days from your average cycle length, and whatever you get at the middle is your ovulation day. So just add about 6 days to that. That is your fertile period. So if you don't want to get pregnant, you're having sex, you don't want to get pregnant, it's just for you to abstain from sex, or you have protected sex during this period. And that would have served as a form of contraception for you. But this only happens in people that have regular menstrual cycle. You can only predict in people that have regular menstrual cycle. So if your menstrual cycle is irregular, this cannot work out for you as a form of contraception. The next slide, please. So, like I said, there are some reproductive issues, early reproductive issues that go unnoticed. And why would any abnormality go unnoticed? Most often than not, it's as a result of lack of clear or early or obvious symptoms. There are some symptoms that that depict an abnormal or irregular reproductive issues, but you can look at it as like, oh, this seems to be my normal pattern. Whereas if an healthcare provider look at it, it may be abnormal on the part of that, and that's the reason why if you observe anything that is not, that is not the norm for everyone, then you should go out to be checked. The symptoms could make some dysfunction in the hormonal system go without noticing it. Equally, most people, especially in environments where we find ourselves, societal stigma is is something that could be embarrassing. Some people, when they have irregular period, they are so afraid to speak out because they are afraid maybe they would, maybe they would be mocked, or they would be looked at as being an abnormal human being. That shouldn't be so. And the other part of it, it could be because the person cannot afford health care. If you want good things, you need to pay for it. So good health care may come as expensive for an average woman, and it may be as a result of this that the person will just ignore those reproductive issues. sometimes it could be as a result of dismissal. Yes, now you've gone out. You went to healthcare provider, and the healthcare provider just dismiss your symptoms or tells you that your symptoms is nothing to worry about, or probably there is an inappropriate interpretation of your symptoms. Maybe that person is not too grounded in the area where you are complaining to, and then will just tell you, oh, what you're saying is normal. Or sometimes we may normalize abnormality. For instance, people that have irregular periods, people with PCOS, we know that most times polycystic ovarian syndrome presents with irregular period, and it could start from early age. So if you notice that that has been your pattern, you can take it as like, oh, this has always been my pattern. Like there is nothing wrong with me. And you'll be surprised that if you go out either to any healthcare provider, they evaluate you, they run tests on you. They will tell you that what you think that is normal is actually abnormal. I mean, having irregular periods, you would say it's a normal thing. Or sometimes we could have diagnostic limitations. There is nothing that is 100%, guarantee. And, but this is not too common, but we can still rule it out. The next slide, please. Now we'll talk about why we should be aware of our fertility. Like I put here, the importance of fertility awareness actually goes beyond pregnancy only. It makes you to also understand your reproduction. It tells you about when you are to ovulate, like what I was showing on the graph that I spoke about just shortly. Okay, that it tells you about your ovulation. You know when your ovulation happens, which is actually the primary event that happens in the menstrual cycle. And equally, it is a direct indicator of your fertility. So we can say in about 90 to 95% of cases, if you are having a regular menstrual period, you are most likely to be ovulating. I mean, if you are seeing your menses like a clockwise, the chances are that in about 90% of cases, you are ovulating. So if you understand that, you will understand your fertility. It equally helps us, being aware of your fertility equally helps us to understand the fertile window. Like I said before, that the period, your ovulation period, and days before, like 6 days before this period, is your fertile window, is your fertile period. So if you want to get pregnant, you can make use of this period. Equally, if you don't want to get pregnant, you can equally avoid this period. So you can see that fertility goes beyond pregnancy only. It also predicts the time of fertilization. Like if you're not sure of when you met with your husband and when the pregnancy is likely to occur, if you have a regular period and you know that, okay, this is the period I'm likely to ovulate and this is the time I had sex with my husband, you can predict that, okay, this is the likely time that fertilization has taken place. Fertility awareness equally helps us to understand the hormone level and age. And of course, we at one point in time or the other would have been told that as a woman age, the fertility activity of such person declines. Remember, I said a girl child has been born with the number of eggs that is going to carry her through her reproductive journey. So by the time you are getting to your third decade of life, precisely by the time you get to 35 years, the egg quality and the egg quantity will start declining, drastically. And that is when you see most women at age 35 and beyond this find it so difficult to, to spontaneously get pregnant without looking for some help or assistance, whether little assistance or major assistance, like going for IVF and all the likes. So from age 35, and this is to tell all women Yes, I'm not saying we shouldn't, be financially stable, but we should look at it that, the biological age of a woman, or the reproductive clock of a woman, start ticking very fast as soon as that woman gets to age 35. And it will become more drastic from age 40 and above. And that is when, most women would have said, oh, this is the time that I'm now financially stable. I can now start thinking of settling down to start my family. So if you want to do that, then you should think about, preserving your eggs before you get to that. Because by the time you get to 40 years and you think of, starting your family at that stage, I'm not saying it is not possible, but it's become very difficult. By the time you get to age 40 and you're just thinking of beginning to start your family at that age, it equally empowers individuals to take charge of their reproductive health. By the time you understand your menstrual cycle and you understand your fertility, you understand your hormones, you can properly take care of yourself. You know when things would go wrong. You know when things are going wrong, you know that, oh, it's likely to be my hormone that is malfunctioning, or it's likely to be my reproductive organ that is malfunctioning, and then when to seek help appropriately. The next slide, please. So we'll now talk briefly about some hormonal imbalance. There are various reasons why there may be imbalance in the hormone system. This could range from either the hormone being in excess or deficiency of the hormones, which would invariably, remember, I said the menstrual cycle is being regulated by the hormone. So the excess of it or the deficiency of it could have impact on the menstrual cycle. It could equally have impact on body metabolism, mood, the sleep, and the reproductive health, because they are all interwoven. You can't separate one part of your body from the other. They are all connected. And the causes could equally range from natural phenomenon like puberty, pregnancy, etc., to disorders due to environmental influence. Now, in the olden days, we usually don't get all these, the common diseases we have now, probably because of two things. Maybe because they are not aware of what, we are in the technology age, so virtually everybody is open to internet and all that, so you can get information easily. But that aside, the lifestyle then tends to be healthy. In the olden days, people tend to indulge in healthy lifestyle. They eat fresh fruits, fresh vegetables directly from the farm and all that. But now we all have everything processed. Most of us indulge, even me that I'm talking, we indulge so much in processed food, synthetic food, rather than natural and organic products. So all these put together can cause imbalance in your hormonal system. Stress is one major factor that can lead to hormonal imbalance. Once you are stressed and the stress continues, there is one particular hormone in the pictorial diagram that I showed called cortisol. So this cortisol can persistently be on the high side, and it will disrupt other hormones that regulate your reproductive functions. And from there, you start experiencing different kinds of hormonal imbalance. Your hormones start behaving funny, that you yourself, you start thinking that what could be the problem. And it could be the chronic stress. Most times we don't know that we are chronically stressed. We just take it as a normal lifestyle, especially for people living in Lagos. You wake up early in the morning, say 4 o'clock, 4 a.m., you hit the road. For people that will drive, they will get into traffic. For people that are going to get commercial, vehicles running up and down before they get to work. Once they get to work too, the stress continue. And this is what we go through from Monday to Friday, every day of the week. And it goes on. And most of us, we hardly go on leave. We think that the more we work, the more money we make. But we forget that as we are making the money, we should equally, take charge of our health and remember our health. Life is irreplaceable. You can be replaced at work, but once your life cuts short, the life can never come back. So as you are hustling for money, remember to equally take care of yourself. Lifestyle, I've talked about that. Different medical conditions could cause hormonal imbalance. Stages of life, menopause is one of what could, around the period when there's a period we call perimenopausal phase, your hormone can start, becoming imbalanced around that period. And the symptoms could include irregular periods, androgen excesses, which could be in form of excessive hair growth, or hair loss, what we call alopecia, or acne, facial acne, dark spots all over the face for women, the neck, the chest, especially in polycystic ovarian syndrome. You get different acne, comedons, on the face, on the chest, which becomes so embarrassing and so annoying. Mood swings, especially for instance, in people that have problem with their thyroid glands, either hypothyroidism, you could start behaving sluggishly, not remembering things, depressive phase, it's all over. Fatigue, yeah, different form of medical conditions could present with fatigue, weight gain in polycystic ovarian syndrome, and equally changes in libido. All these could be symptoms of hormonal imbalance, and it could equally be symptoms of some other medical conditions. You won't be able to tell which one is which until you go out there and the healthcare provider examines you and asks you to do some tests. The next slide, please. Yeah, so I've talked about some of the conditions that are associated with hormonal imbalance. Polycystic ovarian syndrome. Now it's common. It's common than we think. And most people are now beginning to be aware of the fact that whenever you have these symptoms, one and two put together, it could mean polycystic ovarian syndrome. You are having irregular menstrual flow. You are saying that you are gaining weight unnecessarily, and you now begin to have hair distributed all over your body, where men usually have hair. As a woman, you equally have it. You have mustache, you have chin hair, hair on your chest, all over your body. And then you run a scan. Maybe you just hear from your friend that, why don't you go for a scan? You run a scan and they tell you that you have polycystic ovary, you have multiple follicles arranged peripherally in your ovary. That is what polycystic ovarian syndrome is. And most people, it's poorly documented. It's poorly documented. So the other causes of hormonal imbalance are on the slide, ranging from hyperprolactinemia, thyroid disorder, and all that. Then I would quickly talk about importance of diagnostic tests, and then I should be coming to the end of the talk. The diagnostic tests are tools that we as clinicians we use to accurately identify diseases. It equally guides us. Like I used to tell people, we are not a magician. We can't look at you and say, oh, because you've complained about this, and then immediately come to conclusion that this is what your problem is. The diagnostic tools are the ones that will guide us and that would tailor us to what particular form of treatment we're going to be giving you. It also helps us to prevent complication and monitor your progress. We use it to have optimum health outcome, and equally to optimize resources so that we won't ask you to be doing arrays of tests before we come to the end of what actually your clinical problem is. The diagnostic test can be in form of blood test. It can be in form of urine. We can take sample from your body parts, whether body fluids, tissue, what we call biopsy. It can be in form of imaging. It can equally be in form of using instruments like devices like taking your blood pressure and endoscopy. There are some procedures that would have to directly look into your body cavity to know what exactly is going on. So there are different arrays of this test. A majority of the e-health that remain hidden do so because of lack of early symptoms, like I said earlier on. For example, if you have pre-diabetes, you won't show any symptoms. It's only when you do the test, maybe for your annual screen or for your wellness check, they ask you to do glycosylated hemoglobin or to do a blood glucose screen. That's when they will see that, this thing is above normal. And if you are the one that inculcates annual screen in your lifestyle, this will go a long way in helping you to get to the range of diabetes. And the key benefits of this diagnostic test ranges from prevention. They say prevention is better than cure. From screening, for instance, for women, I always advocate cervical screening. Anybody that comes through my consulting room will not go scot-free without doing a pap smear. It's a basic, I do opportunistic screening. Once I ask you that, are you aware of what they call cervical screening, and you tell me you are not aware, I will educate you immediately. And I won't allow you go out of my office without doing the pap smear, because cervical cancer is one of the commonest cause of cancer death in women globally, especially in sub-Saharan Africa. And it is something that it is preventable. For God's sake, we can prevent it. The virus that is implicated in the causation of cervical cancer is something that we get when we have sex. It's a sexually acquired infection. And it doesn't start, changing. It doesn't cause cervical cancer in a day. It's over time. So why not? And the screening is not that expensive. So why not go out? And if you are being asked to do it, why not do it so that you can live a healthy life? It equally helps us, these diagnostic tests equally help us in case management, different kinds of cases. It helps us in monitoring and also to surveillance. Like if we've diagnosed that you have thyroid disease or diabetes or any polycystic ovarian disease, we can use this test to follow you up after we might have instituted our treatment so that we'll know how well you're doing. The next slide, please. And then I just briefly highlight the management for most of this hormonal imbalance or medical condition. For any medical condition that you may experience in your life, lifestyle modification is one aspect that nobody, no matter what your field of medicine is, you would include it in the part of your management, and it actually helps. Well, be it hypertension, be it diabetes, be it polycystic ovarian syndrome, be it thyroid disorder, lifestyle modification is key. Exercises, dietary modification, your diet, mostly vegetables, fruits, healthy vegetables, not all these synthetic vegetables. Healthy vegetables, it helps us. Medications, depending on whatever the situation is, after having used the diagnostic tools, we've now arrived at your diagnosis. Then if it's the one that require medication, we'll give you the appropriate medication. For some people, especially for people in the menopausal phase that have issues with the menopausal symptoms, we can think of hormone replacement therapy, because it's the hormone that has been exhausted in menopause. So at the tail end, when physical measures is no more helping, we can counsel you on hormone replacement therapy. And this would mark the end of my presentation. And as conclusion, I said, to live a healthy life as a woman, you need to understand your being as a whole in terms of your reproductive and hormonal health. It is very, very important. You equip yourself with the knowledge of your fertility, because this goes a long way in helping you to have individual plans, whether for pregnancy, to identify potential risks, or to recognize when to seek specialized care. Hormonal imbalance may be a signal to an underlying ill health or medical problems. So going out, being evaluated, running diagnostic tests would help you to get hold of this. And diagnostic tests, we can't do without them. They are pivotal in early detection, in screening and management of various medical conditions. Thank you so much for listening, and I'll be ready to entertain questions.
Thank you so much, Dr. Waliyat, for that beautiful presentation. I loved how you refer to hormones as messengers that carry messages through the blood to various organs in the body. You also mentioned that the brain controls hormonal release, and that's why imaging of the brain could be requested when we're diagnosing hormonal imbalance. Thank you so much. And one punchline you dropped when you said girl child is born with the number of eggs that will carry her throughout her reproductive years. And some of our young girls are already selling their eggs. Hmm. Well, please, listeners, if you have questions, kindly drop in the comment box. Thank you very much. It is my pleasure to introduce the next speaker, Dr. Afolabi-Obe Eniola, a distinguished family physician and lifestyle medicine specialist. She holds a fellowship in family medicine from the West African College of Physicians. She's also an international board certified lifestyle medicine physician. Dr. Afolabi-Obe currently serves as a consultant family physician at the Lagos State University Teaching Hospital, Ikeja, where she is part of the team currently running the Lifestyle Medicine and Wellness Clinic. Her passion lies in the prevention and lifestyle-based management of chronic medical conditions such as hypertension, diabetes, arthritis, and obesity, alongside patient-centered wellness and health coaching. She's also an active member of the Society of Family Physicians of Nigeria and the Society of Lifestyle Medicine of Nigeria. Please join me in welcoming Dr. Afolabi-Obe Eniola. Dr. Eniola, I think you need to unmute your mic.
Oh, sorry, I forgot I was muted. Good afternoon. I
Good
hope I'm
afternoon.
audible.
Yes, please.
Okay, please permit me to share my slides.
Yes, please.
Okay, please just a minute. Excuse me. Okay. Sorry, I'm experiencing some challenges on my end here. I'll sort that out shortly. Okay. Can you see it now?
Not yet.
Okay, just a minute, almost there. Mhm. Okay, can you share on your end for me, please? I seem not to.
Okay, we'll do that now.
Yeah, please can you share on your end?
Yeah, so 1 minute, please. It's still loading. Just 1 minute. Yeah, thank you.
Okay, that's fine. While we are waiting, I have a question for Dr. Waliyat. Dr. Waliyat, someone said that those ladies that look like men, person wanted to know if it is a function of the testosterone levels that they have, or there is more to it.
Okay, so look like men in what aspect?
Like masculine.
Okay, masculine. Yeah, there are it. You remember I said the type, the gender we're going to be, our phenotype is being determined at the point of fertilization. So if a particular, and during this period, there are so many things that could go wrong in terms of the chromosomal, alteration or aberration, let me put it that way. So if a person, a girl child, has like a female external organ, but the internal organ is that of a male, it's possible. And this could be as a result of aberrations that has happened when that child is forming. Or there are some things that we call inherited, diseases or inherited abnormality. A whole lot of things. It goes beyond a man and a woman having sex alone. The whole thing would be determined by even the genetics of that woman and the genetics of the man. Maybe there is a kind of diseases, in the man lineage or in the woman lineage. It can come when they both come together, whether they know about it or they don't know. It comes together, and then it's their child that would bear the brunt. And sometimes it could be malformation of the hormones, when you have excessive testosterone running in a girl child. Maybe that person has polycystic ovarian syndrome, and then with excess secretion of testosterone, that's the male androgen, then the girl child may now start having excessive body hair, or probably have physique of a man. And it could be external. Maybe the girl child, in recent times, we have the LGBTQ, where a girl child would say, okay, I'm not comfortable with how I'm being created. I want to do transgender and transit to the opposite gender. They start taking male hormones. They start injecting them with androgens, that would then make them to start having body shape of a man instead of a girl. So all this could be accountable for maybe a girl child looking like a boy child.
Thank you very much, Dr. Waliyat. Now we would move to the next segment. I'm calling on Dr. Eniola Afolabi-Obe to proceed. Thank you so much.
Okay. Thank you. Good afternoon once again. Please confirm that I'm audible.
Oh, yes, you're audible, ma'am.
Okay. Thank you so much. Okay, so apologies again for that mix-up. I had some challenges on my end here, but that has been sorted out. So I'll say good afternoon again, everyone, and welcome to this webinar. I'm excited to be here, and hopefully we'll have a great time and a good conversation as well. So just before we start, I want to also appreciate Dr. Jolayemi for laying a very good foundation for what I'll be doing this afternoon. She has said so much already, so I'll be building on that from where she had stopped. So my topic, yeah. So for my topic, I'll be talking about navigating hormonal shifts and staying ahead after 40. It's important for us to just take a pause or reflect on this. I just want us to do this before we start, because what comes to mind most times when this topic is taken, or when you talk about menopause, perimenopause, hormonal changes, a lot of times people have this focus on, oh, it's a gender issue, it's just about the woman. I want us to have a reflection on this point and see that this is beyond women. It affects us all. A woman comes from a family. A woman doesn't it's not just by herself. So when she's able to get the support and the buy-in of all these people, it makes this journey and transition much better for her. Okay. So the next slide, please.
Okay, Eniola, we're on the next slide, please.
Oh, okay, sorry, I didn't see that. Thank you. Okay. I'll talking about the outcome objectives for this interaction. The main, we'll be talking about educating and empowering women, and helping them and inspiring women on how to navigate these changes. Aside that, we talk about hormonal changes women face during midlife, and while trying to have a comparison about what perimenopause and menopause is all about, and what impacts it has on the woman herself, both her physical health, her mental, emotional health, and all that. So we will also be laying some focus on that, and trying to find out what other conditions the woman would experience that would may not necessarily be menopause, but what people may think, or he or she may think that's actually menopause. And most importantly, we'll talk about what can the woman do to get herself ready for this phase. When you're doing something, you're less it comes in easier for you when you have a background, you have a good preparation. It helps you to slide into it, and then it's smoother. So we want to take some words on that. Then preventive testing and how to take control of the health in the midlife point, as well as sharing lifestyle strategies for helping the woman thrive in her 40s and 50s, while also talking about other things that are now coming in place when it comes to this condition, that's talking about menopause. So let me start with this statement. The next slide, the statement about a menopause advocate, Julie Dandika. So I'll just take this statement. She said in India, and I remember Dr. Jolayemi mentioned that while she was having a conversation, that there are still many antiquated rituals and stigmas around periods. For example, in some families, women do not enter the kitchen. They don't cook during their periods. Not a lot of discussions are had on periods, and not to talk of menopause. And so a lot of people don't even have an idea, and they don't even know what to expect. So because of this, a woman is going through changes, but she doesn't even know what is happening in her body. So our thought was, if a woman could go through all this, it's important that a conversation centers around this, such that they are well informed and able to take necessary steps and actions to empower themselves and help them in this phase of their life. So why so much views about menopause? Why so much views about perimenopause? Men say, oh, we are men, we are women. Yeah, it's important because a lot of women, from statistics, shows that millions of women are reaching menopause. A lot of women are still going to attend menopause, but with each passing year, you find more numbers entering menopause. And if a lot of information is not given out on this, the same thing that has been happening and being silent about this conversation, not being visible or not being having a lot of myths, a lot of misunderstandings, still keeps on happening. And that's why this is the time. If there's a better time to talk about menopause, to talk about perimenopause, this is the time, because it gives clarity to women, irrespective of what race, what culture, where they are from. So they're able to have what it is. They're able to know, oh, how do I face this? How do I fit into the gaps? How do we make a diagnosis? How do we make a change in this journey? So it centers around that, and we should take a cue from that as we go on in our conversation. So right about now, I'm sharing, if you're looking at my slides now, I'm sorry, I'm not sure I'm saying this, but if you're looking at the slides, this is they're a group of women. They come under the talk about the foundation that talks about menopause, National Menopausal Foundation. So women share their stories. They talk about their experiences. They talk about what they go through just before they get into menopause, about the time they are there, talking about the perimenopause, and eventually when they attain menopause. So if you're looking at this, you can see professionals, people in other fields of life, different places, different people. He says here that not feeling like yourself is one of the most frustrating experiences as a woman. You know, for a woman, you talk about the continuum of a life stage for her. You know, she goes for, like Dr. Jolayemi mentioned, he said, when a girl child is born, she's already born with, in quotes, all the potential she needs to go through life as a woman, in quotes. So she has all the eggs and all that. So she goes through that, and suddenly she finds out that, oh, I think I am changing. Things are changing about me, but I can't really say, I can't put a finger on it. I can't say exactly what these changes are, why I'm experiencing this. And enough attention is not getting to this. And this is the essence of this conversation. I'm laying this foundation so we would have at the back of our mind that this is quite topical, it's important. As much as we say, oh, it's just about a woman, it's beyond the woman. So, and laying further foundation as to that, beyond the stigma, now when we talk about it, there is a better way to equip them to improve their interest and help them to have disclosures on what they don't understand about this. So right now, I'll talk about menopause statistics, yes. So a lot of figures come around in terms of the number of women that get into menopause, how they assess health, what they do, what changes, how they're able to report their experiences, how they're able to seek help, or what challenges they face at this point in their lives. So according to Fem Aging Tech report, Fem Aging Tech report is more like it's like an initiative that focuses a whole lot on women, especially women peri-40, before or around after 40, because talking about their health, their physical, mental, emotional, occupation, all the things that bothers on women. So there was an estimate that about over 1 billion women will be perimenopausal by 2025. We are presently there right now. So if at this point, as much as 1 billion women are already perimenopausal, why not talk about it? And beyond the fact that they're entering into that phase, a lot of opportunities are also being encountered because of this particular condition, because women are seeking support when they get there. Oh, what can I do? How do I access care? Who do I go to? Where do I turn to? So it's important that they're also saying that as much as $6 billion market opportunity, that's quite huge. You understand? So it should not just be thrown to waste. It should not be thrown to trash. This has to be really, really, really focused on, and key issues have to be discussed. So because while they are struggling with this and they're able to get real-time support, it helps a whole lot to make changes in these areas. Like I mentioned earlier, the World Health Organization also states that the menopausal transition for women by 2030, I talked about 2025, but by 2030, there's most likely going to be an increase beyond what you have even had. So I'll move straight now to other figures. So for an average woman, especially an African woman, studies have found, the report has shown that they are actually attain menopause as early as 2 to 5 years earlier than their other counterparts, the European and American women. That's for an African woman. So, and apart from the fact that they enter menopause earlier, they also their transition is also longer. So in other words, they have more experiences, they have more, in quotes, they are going to experience more challenges. So they need a whole lot of support. I'm not saying those other ones don't need, but, and especially because of where they have found themselves, this part of the world, there are a lot of challenges in terms of finances, in terms of accessing care and all that. So this is also key. That is important. And despite that, it's been found out that at the time they are even attaining menopause, as much as 94% that they had not even received any form of education about menopause. That's huge also. It's something to think about and really act upon. And for those who are perimenopausal, about 49% have been said to speak to health professional, walk up to health professional, in settings that we find ourselves. There are a lot of cultural biases and all that, A lot of times when women come for consultation or when the man comes for consultation, sometimes when you meet the opposite gender, there is a tendency that they may not want to disclose their symptoms, or because they feel that, oh, this is a man, I don't want to talk about it. This is a woman, I don't want to talk about it. So possibly a lot of women encounter male doctors and just say, oh, I don't think a male doctor may likely be able to attend to these needs of mine. So they may likely shelve it off or not talk too much about it or evade it entirely. So that's one thing we should also take note of. And for those who are postmenopausal, as much as 58% of them have also try to seek attention from healthcare, from doctors, health professionals, and all that about that. That's also interesting to find that. Then, besides that, this is also very important. It's been said that even for those who have attained it, they wait for such a long time to even disclose it, to even talk about it. So for those who could have even gotten help, who could have gotten support, it takes some time. Just like we said, a lot of, because cultural biases, stigmas, having not even know. For some people, they don't even know what exactly it is. They just be like, oh, it's just a normal part of my life. So maybe I'm possibly stressed. I'm encountering some things that are just a bit of part of my life and all that. So same goes to working women in the working class group. So we talk about the fact that, I mentioned physical health. So as much as that, their occupational health, their work-life balance is also impacted. So it's a whole lot. From a study from the Mayo Clinic, it talks about that as many as about 4,000 women at the time this study was done were actually in full-time employment while they were experiencing these symptoms. And because of that, they had to miss work. They had to miss work because of these things. So it's those are statistics, yeah. So it's important we draw inferences from this while we talk about it. Looking at this other slide also, talking about the next slide, yes, about the people these women have discussed their transition with. to menopause with. You know, it was grouped into ages for those 35 plus, 35 to 49, and 50 plus. If you look at this chart, you find out that majority definitely have turned up to the health provider. The next group after this were friends. So, like I said, if the friend doesn't know much, or the friend may likely give what he or she knows about that phase of the experience to the person who is seeking help. I once encountered a woman. She was actually perimenopausal, yes, and you know, she had so much worries. She had so much fear that, oh, I have a friend who is experiencing, who just attained menopause, and she was really scared about the things she was having. I was like, is this how I'm going to become? Is this what's going to become of me? You know, and so for that kind of a person, give her example, if she had not sought out care in a health facility, and she just takes her, this is what it's all about. And she may just build her affairs on that, not knowing that she could actually get help and she could try better despite all those things she has experienced. And for all we need to know also, the experience is not the same for all women. What one woman will experience and what the other woman would experience is they are a lot different. And it's also important to know that the relatives were also spoken to. Then mothers, yeah. So like I mentioned now, you know, not everybody, I'm sure that a lot of people on this call now, may not definitely be all women, but you know, some may not even be menopausal, some may not be menopausal, but at least this information, this is important. The daughter could pass to the mother could pass to the daughter. So it goes all around, because this is where this information comes from. Thank you. So hormonal transition, yeah, that's talking about the crux of our conversation, hormonal transition. So like I mentioned earlier, Dr. Jolayemi had laid the foundation, so I wouldn't talk much about this, about the reproductive and life cycle of a woman. Talked about the hormones that tries to sensitize, send some hormones from the brain. Yeah, there are some certain things that are stimulated from the brain that are being released, and because of that, the menstrual cycle comes up. It gets on. Okay, from the follicular phase, the luteal phase, the interactions of the follicle stimulating hormones, estrogen, progesterone, and luteinizing hormones. This all comes in place just about the time the woman is about to menstruate. The ovaries, which is we talk about something called the ovarian reserve, because that's what Dr. Jolayemi, she said that as the woman transits, each cycle, each month, she keeps losing that, and the reserve keeps depleting. So as she gets to the edge or to the tail end of her reproductive life cycle, this deepens a whole lot. And sometimes, because it looks like to the body that, these things are not being released, so it sends a feedback back to the brain that, we are not getting enough, we need to get more. So it kind of saying we are flogging a dead horse. It cannot produce any longer, but because it's no longer there, it sends another signal, says, okay, follicles, you need to bring out more of this, but they are no longer there. So that's one of the things, the first signs that will tell you that, these ovarian reserves are actually getting into depletion. So that's one of the things, one of the tests that's usually requested for a woman who is around perimenopause or menopause. It helps you to diagnose, that this is actually menopause coming up. And we'll still talk a whole lot more about that. So, and this practically states around the same thing. The next slide talks about reproductive aging and menopausal transition. If you look at these arrows, looking at this arrow, if you look at the tail end, you have cycles being regular. The follicle stimulating hormones are still within the normal ambient, but just as the woman grows older, these cycles are not as regular as they used to be. Ovarian reserves become lower. Cycles are now longer. What we mean by cycles? For a cycle of a woman is the entire, that means from the start of one menstrual cycle, that's from the day one to the time she sees the menstruation this particular month, till the next time she will see another one. So as the woman becomes perimenopausal, a lot of times these cycles begin to lengthen, and that's one of the things that would also give us a clue that, oh, this is actually happening. And it's because the regular hormones that are being released to bring about these regular menstruation, they are no longer there. So that's what we find happening. So hormonal changes in midlife. So it's important to know that as much as there are reproductive changes, yes, when you talk about fertility and all that, it's also important to note that hormonal changes are there, and those changes are they make a lot of impression on the woman. So there are two stages of the perimenopausal transition. We talk about the early cycles. I talked about that just a while ago, and we have longer cycles. And for some, it says the amenorrhea could last for as long as last at least 60 days before you even get to the final menstrual period. And at this time, the follicles, the ovaries are waning out. The luteinizing hormone surge is being depleted also. And looking at this slide, it talks about as an FSH level greater than 40 units per liter on two separate occasions, at least 1 month apart, is diagnostic of menopause. So when a woman comes to the hospital and she's requested to do some of these investigations, it's because we are trying to find a clue to what is happening here. So what is perimenopause? So according to the American College of Obstetricians and Gynaecologists, it's been defined as a time leading up to menopause. So it's actually not a particular time, it's a transit. It's characterized by menstrual irregularities, there are fluctuations, there are a lot of changes. However, it begins from the onset of when that cycle becomes irregular. Please note that till after a year when she has not it ceases entirely, that's amenorrhea, when she now doesn't see the menstruation at all. That's the final menstrual period. So it's like it's a variation. It could last for as long as few months to years for women. And it's a natural transition that marks the body's end, or it marks the end of the reproductive cycle for the woman, and it's been accompanied by a lot of symptoms. Hot flashes, yes, that's quite common. When you ask anybody, I'm sure that hot flashes and menopause are quite synonymous. The first thing anybody thinks about when you talk about menopause that comes to mind is hot flashes. However, it's also good that we know that there are a lot of other things that we don't even know actually related to menopause, which we'll find out shortly. And it's set to begin in the 30s, 40s, and like I mentioned earlier, it could last for as long as few months. So you may not be in the 50s, like a lot of people say, because sometimes when you interact with certain people, I've interacted with quite a number of my patients, and they tell you that, oh, I thought menopause, a woman doesn't enter menopause until she's 50. No, that may not be the case. You understand? So it's important that we know that it's a transition. So the woman is aware that she's going through this period, and the transition, when it's well understood, is better adjusted to. So a lot of times, like I said, perimenopause is misunderstood because it comes in like there are other things that could cause it. Some women, a lot of times, like I said, they could think that, oh, I'm just stressed. Maybe I've not rested well enough, or I'm going through challenging times. Yes, because this time is usually synonymous with a time in a woman's life, maybe our midlife. So there are a lot of things she's also encountering. For a woman who is having a growing career, for a woman who is a home carer, who has challenging duties, or who has other things, you have to take care of this, do all that. So sometimes, even though those conditions are there, it could be interpreted and said, oh, it could be stress, or it could be because they're aging, and because of that, care is not sought for on time, and it's also a roller coaster. Yeah, we all know what a roller coaster is, I assume. So it comes in. Sometimes the woman is fine. Sometimes she's healthy. She's just happy. She's all A and gay, and suddenly she's all changed all over again because it keeps changing. And so it's important that these hormones are tracked to know, oh, when this stage is reached, or when this stage is being attained, the woman is able to, or even before she gets there, or while she's transiting, she knows what steps or actions to take that would make it a better experience. So now going to menopause. Menopause has to do with when there's the menstrual flow has ceased entirely, and this is a retrospective diagnosis. What do we mean by retrospective diagnosis? It's a diagnosis that is made after. It's not. You cannot say it has happened before. It's after that thing has happened. You would say a woman has attained menopause. So for a woman, for example, who still had possibly had a menstruation last year, if for example, say last year, we are in September now, maybe last year, December, and has not seen her menstruation all up until September. If the woman still sees her menstruation today, she cannot be termed to be menopausal, because if you look at the timeline between September last year and today, it's not up to 12 months. So for that woman, you cannot say she has attained menopause. It's also important to know, like I mentioned earlier, that it's natural. However, we'll still see later that sometimes it may not always be natural. Certain things can also come in place that could cause a premature menopause, or other things which we'll also subsequently talk about. And so natural menopause is deemed to have occurred after 12 consecutive months. Yeah, so the 12 months is consecutive. It doesn't mean that, oh, I'm going to take different months altogether, but it has to follow through a phase like that. And an average age a woman is set, the average age for which women attain menopause is between the ages of 40 to 58. In the United States, is said to be about 52 years. However, a recent Nigerian study found out that reported 52.8 as an average age that a woman attained menopause. So comparison, just a quick one, just for us to have an idea. So in terms of definition, I think that is clear already. So the timing also. So it varies. It could be as long as 10 years. It could be as short as 8 years from the timing the woman eventually attains the menopause. Then for the menopause, we already talked about 12 consecutive months. Then for the hormonal levels keep fluctuating when it comes to perimenopause. However, for menopause, the hormone at this point now, the hormones have actually reached a stable level. They are no longer fluctuating in cycles any longer. So they are low already. So they are sometimes not even accessible. The menstrual cycle, like I mentioned earlier, it could be shorter, it could be longer, variations, regular, skipped, and just not like the normal menstrual cycle any longer. And fertility, like mentioned earlier, could still be achieved, because sometimes some women assume that, oh, I've not seen my menstruation, maybe because I have not seen it for a while, possibly person skipped 3 months, 4 months, will assume that, oh, I'm unlikely to get pregnant. So it's advised that those people they are on contraception pending the time they actually achieve the menopause. However, for menopause, fertility is actually possible. However, that may not be possible without assisted reproductive technologies like IVF and donor eggs and all that. So, yeah, like I mentioned before, beyond the fact that menopause could be natural, there could also be premature menopause, and that is menopause occurring before the age of 40. So when a woman attains menopause before 40, she's said to have a premature menopause. It's also referred to as premature ovarian failure or primary ovarian insufficiency, because for sometimes it may look like stigmas. By the time you tell a young woman that, oh, madam, you're already menopausal, no? There are a lot of stigma that comes around it. So some women don't even want you to say the fact that, oh, you are menopausal already. You don't want to hear that word. So sometimes if you use these terminologies, it helps you to be able to suit or manage your patients and you're able to guide the patient through and give more clarity when it comes to this. So for those women, it could be because of certain chromosomal abnormalities or autoimmune conditions. SLE, a lot of things, autoimmune condition. And for women, autoimmune conditions are found to be commoner amongst women. Surgical procedures, removal of the ovaries in terms of ovary removals, medical interventions like radiation, chemotherapy could also be a cause of premature menopause. Hysterectomy could also be a cause. And it's also what we should note about this, because this menopause, it's not for this set of people, it's going to be different because it's not a transition any longer. It's a sudden thing. So for them, they are likely going to encounter more pronounced symptoms compared to those who actually go through a natural form of menopause. And it's also important to know that by the time a woman reaches menopause, some of these symptoms, they begin to subside. They begin to subside compared to what they had when they were in the perimenopausal phase, because now there's entirely lack of estrogen that makes them vulnerable to those conditions they had experienced earlier. Stages of menopause, I wouldn't want to stress so much about this. Premature and early menopause, if you look at the picture, it speaks to that. Premature and early menopause. Perimenopause, that's just before menopause, the natural menopause, and postmenopausal stages. So please, at this time, I don't know if you are looking at my slide, I can see there's this slide shows varying symptoms a woman would experience while she's menopausal. So can you just type in the chat box, like 3 changes you can see at the moment? I can see quite a number on my own slide. You can type in the chat box. I can see mood changes here: sleep problems, hot flashes, irritability, weight gain, panic attacks, depression, anger, mood swings, slowed metabolism. So to be sure that we are following, please type in the chat box symptoms you can see here for menopause. Okay. So, however, it's important to know that the very common symptoms experienced by these women are hot flashes, night sweats, quite common. It's been said as much as 80% of women would experience this while they are going through this phase. And as much as about 24 conditions have been mentioned, have been noted to have been related to this, to menopause. Looking at this slide, you can see that some slides were highlighted in red. Those are quite common: hot flashes, night sweats, irregular periods, sleep disturbances, difficulty concentrating, sore joints, and all that. But we can also see that body odor could be part of it, gum problems, tingling sensations. We could also mimic other conditions that could come up in the midlife. Those are chronic conditions. A lot of times, chronic conditions also begin to stem around that particular age. Electric shocks, bloating, incontinence begin to come. Memory lapses. For somebody who has been able to hold it all together, put things together, suddenly finds out that they just enter a room and they can't remember why they're actually in that room any longer. And all that. So get irritated, panic attacks, hair losses, acne, and all that. So quite a number. Fatigue, they get tired easily, and all that. And the roller coaster of emotion, estrogen, progesterone, fluctuations, and all that. So let's not delve too much on that. We've talked about hot flashes, sleep and mood disturbances, and fatigue, memory. These usually occur because of these fluctuations, especially with the estrogen. Estrogen has a lot of serves a lot of modulatory functions in the body when it comes to before menopause. So by the time it begins to deplete, these things begin to set in. So cortisol, which is the stress hormone, also begins to come up at this time. It's worsened, and we all know that when you have a counter-regulatory hormone coming up, a lot of the negative effects of those hormones comes up with it also: elevated blood pressure, insulin resistance, poor sleep, mood issues, and all that begins to crop up also. Thyroid imbalances are actually also very common at this point as well. So I would really want to key in on these features: mood changes, sleep disturbances, decreased energy, cognitive changes. So for a woman in this phase also, so a lot of times when you note mood swings, irritability, anxiety, worries, and all that, it may not be entirely related to other issues around. We could also begin to think about menopause. So when you begin to see these things, it may be a reason to seek a clinical consultation and know what steps to take. Sleep issues, insomnia. So when you talk about insomnia and sleep deprivation, they are quite different. When you talk about insomnia, that means the person actually has a chance, you have the opportunity to sleep, but you're not sleeping, compared to sleep deprivation, where you are depriving yourself of actually sleeping when you, like, give, for example, preparing for an exam or trying to meet certain deadlines. So that's quite different. But for insomnia, the person is just tossing on the bed, not being able to sleep, gets to the bed, wakes up, rolls up, and all that. So that's one thing to also note. And at that point also, there are a lot of challenges with productivity begins to deplete, it begins to reduce. So talking about diagnosis right about now, menopause is a lot of times diagnosed using ovarian test, ovarian function test. We talk about the anti-Mullerian hormones, not commonly done though, but majorly the follicle stimulating hormone, estrogen, thyroid function test also are key tests that needs to be done, because around this point, thyroid issues could also mimic menopausal symptoms, which also needs to be done. However, also let's know that an HCG test, that's a pregnancy test, could also be important, especially around perimenopause, to help rule out pregnancy, because sometimes it could also be pregnancy for those women encountering perimenopause. So what does tracking hormone entail? It primarily involves, like I mentioned, getting attention or assessing the care on a healthcare facility, speaking to a healthcare provider, is able to get the history, follow up on what you've been experiencing, and request for necessary investigations. However, self-tracking could also be done. The woman could actually do what we call the menstrual cycle monitoring. Now we have a lot of cycle apps that could be used. We have, in the digital age, a lot of people who have Android phones. You could use a lot of the flow apps to track the period, to see if there are changes. For a woman who has actually noted a regular cycle or a regular length or regular flow, but if this tracking is done, when changes begin to happen, the woman will likely note that something is happening. And when these tests are done, the confirmation for menopause could be done, or if it's perimenopause also could also be done. So like I mentioned earlier, doctor's assessment history, very important, because history gives you a background to what she's experiencing. It tells you, oh, are there other things that are also background? And it's also important to know that it could not just be menopause alone, it could be other things the woman is also experiencing that would also have a background with menopause. So as much as we are thinking about it, other things should also come in place too, and should be investigated. Period tracking, symptom journal. The woman could have a journal to track her symptoms and all that, a consultation. And what are the benefits of tracking for hormonal tracking? I wouldn't flog this much. Dr. Jolayemi had mentioned earlier. It helps you to identify your patterns. That's been said already. When there are irregularities, you're able to know. And I like this particular, when you talked about empowerment and control. It helps you to know what your reproductive cycle or reproductive health is like. You're able to, it's not about somebody else giving information about yourself, but something you know, you're able to make dedicated changes or make necessary adjustments or seek information as necessary when it comes to this. Fertility awareness, yes, quite important. It helps also for those planning family, and it gives a lot of a lead and guides you into how to take necessary decisions. And it helps to also have informed decisions when you're conversing with your healthcare provider. If you're able to give information that helps the provider know what you're going through, then he or she is better able to assist you. Then we talk about the health risk a woman faces after the menopausal period, post-50, commonly bone problems, heart issues, then cancers. Yeah, so for a woman, it's been said that as much as 20% of bone loss happens during menopause. So for women who attain menopause, a lot of emphasis is being said to be placed on the bone health, because they stand the risk of osteoporosis. So when you speak with the doctor, you would be better guided on what investigations that needs to be done. If, for example, we talk about the bone density evaluation, the bone density scans are being done to evaluate for osteoporosis and the need for the woman to get sufficient levels of calcium, vitamins, and all that. And this we will stress that this comes from eating healthy food. We'll still come back to that in a short while from now. The heart health also very important at this point because the cardiovascular risk increases, especially when it comes to menopause. And why does it happen? Because the protective hormones, the progesterone, progestogens, the estrogen, they're no longer there. So now the woman is faced with a lot of risk of coming down with chronic conditions. If chances are not, if she leaves it to chances, yes, atherosclerosis is something to be wary of. That has to do with those fats like clogging or blocking a vessel. Just picture a pipe, and picture a pipe that is used to get water. You can imagine if a stone or something blocks it, the flow is not as quick as it is going to be as it used to be any longer. So that's what high cholesterol could do. Atherosclerosis could come up, heart disease, stroke, and all that could also come up. Cancers, yes. Ovarian cancers, uterine cancers, cervical cancers, breast cancers. They also at this point begin to crop up, and mammograms have been found to be effective in quick and early diagnosis of these conditions, and other tumor markers would also come in place. Preventive testing, bone density scans for osteoporosis, cardiovascular screening, cholesterol to check cholesterol levels, the ECGs, hormone panel, cancer screenings, and baseline investigations that are necessary to be done should also be done. This gives the next slide talks about the screening recommendations for breast cancer for having a mammogram done. From the age of 40, it's been said that a mammogram screening should begin and should be done every 2 to 3 years. Well, for a woman who has a higher risk, she may need to start earlier than that. Pap smear is also recommended from the age of 21 years, every 3 years. The HPV test also every 5 years. So really important preparation. A woman's health status while entering menopause is largely dependent on what her health has been previously. Just like picturing a foundation. If there's a weak foundation, it's a weak foundation interprets or means a weak building. So if she has a good foundation, when we talk about reproductive history, her lifestyle, environmental factors, there are baseline that needs, if they have been well before then. So that's the emphasis that's been placed on having to have these things done, to have these things on ground. So even before a woman, even for those who are just teenagers, now we may begin to talk to them to make those necessary changes in their lifestyle as they need to do. So it's beyond hormonal changes, biological changes. It also has a lot to do with socio-cultural factors that needs to be put in place when it comes to menopause. So quick to the treatment options. Hormone therapy has been put in place at the tail end if those other activities or if other lifestyle factors are not really helping out for the woman. Talk about hormone therapy, non-hormone therapy. Now there are a lot of herbal supplements, dietary supplements that are being patronized, that women now patronize just because of menopause. Then yes, talk about healthy lifestyle decisions, nutrition, high calcium, vitamin D, healthy fats, lean fats, exercise. Yes, we talk about the weight-bearing exercise has been found to improve bone health. Cardio exercise is also it helps to improve the mood, bone density, and the likes. Stress management important. We live a quite stressful environment, like she mentioned. Lagos is not even in Lagos. Any other place you may find yourself. Breathing exercises, meditation. Establishing a good sleep hygiene helps a whole lot. You have to regulate cortisol. That brings a whole lot of change to these areas. And other lifestyle strategies. Alcohol, avoiding alcohol is also very important. It's been said now that there are no safe levels of alcohol any longer. It's been said that it's not just about taking low levels, but any level is not even safe at all. So as much as the woman should avoid it. And the integrative approach together. So that comes in place when it comes to menopause. For healthcare, complementary medicine, it's not conventional, but those things sometimes have been found to be helpful. A 2019 Danish study found that acupuncture brought some relief to women experiencing various symptoms related to menopause, especially hot flashes, sleep issues, and mood changes. So just a quick one, sorry, this is not part of the slide, but a quick reflection. This statement from Walt Disney talks about the way to get started is to quit talking and begin doing. So we've done a lot of talk today. So let's begin to do something from what we've been saying. So as I begin to round up gradually, supplements. A lot of these things may not be regulated. They are not regulated, but some also have potential side effects and contraindications, especially for a woman who is also on other medications. So it's important that even when a woman wants to start some supplements, it's important to speak with your care provider. Let them know. Be aware that these things may not likely interfere with the medications you are taking. Commonly, we are aware of evening primrose. I'm sure a lot of people know about evening primrose. That's commonly been recommended a lot of times for women going through menopausal period, perimenopausal. Flaxseed, lifestyle, nutrition comes in place at this point for the woman. In lifestyle, we talk about something called the dreams. This stands for your diet and your nutrition. So when you're talking about that, talk about healthy plant-based diet, whole food plant-based diet, not refined diet, and most times, and a lot of fruits, vegetables, herbs, and seeds, and all that comes in place with the diet as well. Regular intake of vitamin D. My slide here talks about recommended intakes for perimenopausal women for when it comes to calcium, vitamin D. We want to take a look at these slides after now, and the impact of having to take healthy fruits and vegetables also. So what direction are we facing towards menopause now? Yeah, a lot of new things are coming up. Now they are coming because of the negative effects of hormonal therapy. New non-hormonal therapy are now being worked up for use, safer hormone therapies that will reduce the risk of women using them coming up with other conditions that are not in what they desire. Personalized healthcare now, telehealth. Yes, a lot of telehealth clinics are on. The woman could talk to a caregiver, could talk to a physician, even without entering the hospital facility. Telehealth goes a long way for perimenopausal women. It helps to address long-term health risks. And right now, patient education awareness, which you are presently doing at the moment, the woman can gather knowledge and help to improve on what she needs to do and what she needs to know regarding her health. So in all, I will say again, menopause is not a disease. It's a transition for a woman, because a woman's life cycle is a continuum. So don't assume that once she's in menopause, her life has ended. No, it's still just a continuum which she needs to adjust to and make necessary changes as the needs may be. Raising awareness, we cannot stop it. We need to, if there's any better time to raise awareness, this is the time to do that. And emphasizing a life course approach, like I mentioned. When I talk about life course, catch them young. You can start, yes, from the primary, the school health, teenagers, the adolescent, young adults. Take them now. Begin to get them aware, and with all this, it helps the journey to be smoother and better. I would like to end at this point. Thank you for having me. These are my references.
Thank you so much, Dr. Afolabi-Obe, for that insightful presentation. Doctor mentioned that perimenopause begins with the first onset of menstrual irregularity and ends 1 year after amenorrhea has occurred. That really sent chills into my body. And then you said it could start as early as the mid-30s, and that the hormone levels fluctuate like a roller coaster. And then don't get me started on the symptoms, the anger, the mood swings, the depression. A lot is going on in the woman's body. I'm so grateful that we are able to learn from you today. This was truly an eye-opening session. And before we go into the Q&A session, there will be a feedback poll that will be appearing on your screen shortly. Do well to fill it. So at this point, while we do that, I will start with the questions. So this first question goes to Dr. Waliyat. Dr. Waliyat, are you still with us? So this one says, Good morning, Ma. I have a question concerning menstrual cycle. If one has irregular cycle, such that they can go up to 10 months without period, probably due to hormonal imbalance, will that be menopause setting in? Dr. Waliyat? Or Dr. Eniola, you can actually jump into.
Okay, please can you take the question again?
Okay, so if one has irregular cycle such that they can go up to 10 months without period, probably due to a hormonal imbalance, could that be menopause setting in?
Okay. Well, I would not say that. Then the setting of the question is not complete. I need to know how old is this woman? What's her fertility? I know, yes, I need to know, is she on medications? What is her history like? Because I may not give a definite answer to this question because I don't have all the information at hand. So, but for a woman who hasn't seen her period for 10 months, it's important that you would even find out what is causing it, because it may not be menopause, depending on what age what the age of the woman. Or somebody who has PCOS and all that, I could also experience things like this. For people who are on certain contraceptives, or people who are taking certain medications, or certain things happening. So, with this, the woman has to seek help, get to a health facility, let the history be well taken, and the necessary tests be done. That will give clarity to the experience the woman is having, because she may not, or she may be having perimenopause, but for her, if it's that long, it could still be, it may not be. So until we have a full information at hand.
Okay, thank you so much. This other question will go to Dr. Waliyat. That's fine, ma'am. I have a question for you actually. So is it okay to have a flow of brown blood on the first day of menstrual flow, and it has been consistent for 6 months plus now?
Okay, I get that kind of complaints often, that people would say my menstrual blood is not bright red. Once your menstrual blood is bright red, then it's a problem, because it is actually the shedding of the lining of the womb that comes out as menstruation. So it's not only blood, it's blood together with tissues and other things, like a cleansing mechanism. The lining of the womb has passed through different hormonal changes, different phases. And then we expect that once the egg is released at the middle of the cycle, it should come in contact with the sperm or with the spermatozoa. If this does not happen, then of course the hormone will carry on. And then when the lining of the womb continues to pass through the other phase, the luteal phase, and there is nothing to implant on it, so it's shed. So I don't expect the blood that comes out to be bright red. So it can be, brown, it can be dark red, it can be, but once it is bright red, then it's a problem. The person should be running, There are so many things that could cause that. I mean, excessive bleeding. But menstruum is not meant to be bright red blood, because it is not bleeding coming directly from the vessels.
Thank you very much. So, Dr. Afolabi-Obe, this is for you. Somebody says, I want to know if excess heat in the female system can affect fertility. She is 2 months in marriage and her body temperature seems to be abnormal. She has noticed that it has lasted for a long time, since her primary school days. She could sit near someone in public vehicle, then the person asks if she's fine because her temperature is quite high. It's a concern for her. So, Dr. Eniola, please. Mute. Unmute, please.
Yeah, thank you. I just unmuted, yeah. So for her, sometimes you talk about subjective temperature check. So for that kind of a person, is it a subjective Like, did she actually use a thermometer to be, and was sure that her temperature was not within the normal range? Because sometimes somebody feels you and say, oh, you're hot. But that may just be because your own body is much in comparison with that person, but may not necessarily mean that that person is actually having a high temperature. But the first thing I would say is that let her be sure that she's actually has a high temperature. A high temperature is not the same thing as hot flashes. Please, let's get that. For hot flashes, it's more like a neuroregulation taking place. So, but the brain is sensing it as something different. And because of that, it kind of wants to cool down the body. So it hits it up and just does a sudden cooling, and the woman feels that heat and then feels cool and then suddenly feels cold again. That's different from fever. So let the woman be sure, is it a fever she's having, or she's having those temperature spikes and all those changes? So she may want to run baseline tests to be sure that that is the reason. And for that, that's not a reason to not to achieve conception. There may be other background, or there may be other underlying conditions she may be experiencing that may be the reason why she's not been able to achieve conception, which she may want to find out. I hope that answers the question.
Yes. So I'm coming back to Dr. Jolayemi. So somebody said she started her menstruation at 14 years and her menstrual cycle is 28 days. She is 47 years plus. And at what age does she start experiencing a premenopause sign? The only sign for her now is insomnia, and her cycle is reduced to 22 to 25 days. She's asking to advise if she needs to go to do checkup on her hormonal status to see if they're already changing.
Okay, yeah, that's a good one. She's actually in the perimenopausal phase, like Dr. Eniola had said. The perimenopausal phase actually has a duration. It's a range. So being 47 now could depict that she's in a perimenopausal phase. The cycle may initially become lengthened, and then in between you could have a shortened cycle. It's just intermix of shortened and lengthened cycle before it eventually stops. And when the stoppage had spanned through a period of 12 months, we can then say, okay, this person is, menopausal. But 47 years, she's definitely coming gradually to the end of the reproductive phase. So going for check should be like a default mode for everyone, not until you start experiencing something. Insomnia, like Dr. Eniola had said, insomnia could be part of the perimenopausal symptoms. So it could be our own first symptoms, not necessarily that everybody has to have hot flushes as their symptoms of perimenopause or menopause. In fact, some people may not even have hot flushes. So insomnia is one of the symptoms that could show us, or that could signal to her that she's probably in that phase. So I will advise her, of course, she should go out to see the doctor for her to be properly evaluated.
Okay, thank you very much. So I have one for Dr. Eniola. She says, good day, Ma. Thank you for this eye-opening seminar. She has 4 questions. I'll try to run through it. She's 39 with a regular cycle of 4 days flow. She has 4 kids. Now, over 8 months, her menses last for just a day, at most 1.5. She's asking what could be the root cause. She gets too tired easily, even after she's well rested. She just wants to sleep. Her libido is practically dead. She doesn't know what to do. She takes supplements, omega-3, magnesium, and some months. Well, woman, is that okay? I think that's all.
Okay.
Yeah.
Can I go ahead?
Yes, please.
Okay, thank you. Oh, for that woman, the age, the first thing about the age, it gives it out. She's 39, so she's about the age where, around the age where that happened. So that is already something to pick on. Then those things you mentioned, definitely they have a close look to hormonal changes. It talks about I talked about the fact that the menstruation could change. It could be shorter, it could be longer, the flow could increase, the flow could reduce. So that's one thing already. Then the fatigue is there. So, I'm sure that she has 4 children, definitely. That's something, I don't know how other things, the work she does and all that. So there's already a background stress already, if I may say, possibly. So there are a lot of things that may come in place now. We talk about possibly the impact of perimenopause is actually coming up. The perimenopausal stage, she may actually be in the perimenopausal stage. Then we also need to rule around or speak around our lifestyle. How stressed is she? That's important. But I would just say at this point for the woman, the next step I think she should take is let her seek consultation. Let her be seen, and let a better history or other things surrounding her symptoms or experiences. Let her tailor them. Let her speak out about them, and she could be requested to do certain investigations, possibly hormonal tests. Then other things that may also point out to. You said?
No, please proceed.
Okay, thank you. So I think baseline investigation would also work, would also be fine for this woman. But primarily, let her have that. Then she may also begin hormonal tracking. That may also be important. Then a lifestyle generally should also be looked into and find out what other things that are also coming in place that we are not sure. A medical history is also very important. Then what has the previous reproductive cycle, what has it been like? What medications is she on? Is she on any form of contraception? She uses any medication for any condition? Does she have any chronic condition?
Okay, thank you very much. So I have another question, and it's centered on HPV. Somebody asked, on an average, at which age and how frequent should a woman be screened for HPV? Does every case of confirmation of HPV strains associated with cervical cancer in a woman require immediate medical intervention? Somebody also asked about the vaccine, the screening, and then pap smear tests. So I just wanted to merge together so that we can have one answer for that. So I will go to Dr. Waliyat for this.
Okay. Yeah, I'm happy that question is being asked. Okay. So as part of the measures that WHO and different organizations are doing is and thankfully or gracefully, Nigerian government too has key into that, into that initiative. HPV vaccine is now available in different health centers for young children, girls from the age of 9 to 14. They should get vaccinated. Is actually something that you are doing those girls huge favor. Okay, so how often should HPV test be done, or what's the second question? Can you take that again, please? The screening. Was the question like how often should it be done, or?
On an average, at what age and how frequent should a woman be screened for HPV? Okay. Does every case of confirmation of HPV strains associated with cervical cancer in a woman require immediate medical intervention?
Okay. So HPV screening or cervical screening generally, because there are different ways to screen for pre-malignant cervical lesion. It's just that currently HPV is taken as the primary screening method. In some centers or in some places where HPV screening is expensive, they still go with the pap smear or the visual inspection with acetic acid. But I will limit the answer to HPV. HPV is a sexually transmitted infection, so screening should be started for all sexually active women. It depends on where you are. In America, they start from age 21. In the UK, you start getting the notice 6 months to your 25th birthday. By the time you clock 24 and a half, they will give you the first, they will send you the first letter. And by the time you're clocking your 25th birthday, they will send you a reminder to come for your first screening. But in Nigeria, I mean, we can take it from 25 years and above, 26 years and above. But as soon as, once you are sexually active, then you should be screened for HPV vaccine. So that will settle that. And how often? HPV screening can be done every 5 years. But it can be done earlier in people that have immunosuppression, like in people with HIV and all that. Their own screening is shortened every 3 years. But in immunocompetent people, it's every 5 years. Then the other, should you be worried when you have HPV screening positive? There are different serotypes to HPV. We have the high risk and we have the low risk. The low risk have not been implicated in the causation of cervical cancer, but they also have what they are associated with. Like the subserotype of 6 and 11 is implicated in genital warts. So that one does not cause cervical cancer. But if it is the high risk, and there are some basic high risks that are common and they are notorious for cervical cancer, like the serotype 16 and 18. They are the aggressive one, especially serotype 16, the aggressive one in causation of cervical cancer. So once you have HPV 16 or 18, in recent time, they've added 35 and 45. If it is positive, yes, they would now run a reflective or reflex cytology. Cytology means getting scrapings of your cervix. If that shows any abnormality, then you should go for the next stage, which is colposcopy. Colposcopy is just like a camera magnification of the cervix, in addition to adding some reagents. So if we see it under colposcopy that there's changes to these reagents, then we'll take biopsy. But the teaching now is equally that you don't know when these people would come back. Most women, like I said before, that I do oftentimes I do opportunistic screening. Someone that just came for something else and you did cervical screening for, you get something abnormal, you want to treat immediately because you don't know when the person or whether the person will return for follow-up. So in areas like low resource setting, in which Nigeria is one of them, they do see and treat. Once you see, you find an abnormality, then you treat immediately, because you don't know whether that person would be back for follow-up. So there are some cases that you treat. There are some cases that you give follow-up, especially if the cytology is normal. You can say, okay, repeat your test after 12 months, because we know that this HPV, once you acquire it, your immune system is expected to clear it up within 12 to 24 months. It's just the persistence of it that will then lead to changes in the cervical cells. So if your cytology is normal, we can say, okay, repeat your test after 12 months. If after 12 months, your test result still comes back as positive, with or without abnormal cytology, then you go for colposcopy and treatment. So that is the way it is. I hope that I've answered the question.
Yes, you have. Thank you very much. I am afraid this is the much we can take because of time. A kind reminder to all our guests to fill the feedback poll on their screen. A special thanks to both speakers for sharing valuable insights, and to everyone here for your attention and engagement. Today, we have explored women's health from a holistic perspective. As we bring today's webinar to a close, I would like to introduce SYNLAB Luna. It is a health screening package to support women. We have the Luna Bloom for women planning pregnancy or checking fertility, screens for ovulation and ovarian reserve and all that. We have the Luna Align for women balancing career, family, and wellness for 30s to 40s, screens for hormonal balance. We have the Luna Grace for women of 40 to 50, for women in transition to menopause, and we have the Lunar Glow for 50 and above women for full body wellness, your vitamin D, bone health, heart, cancer screening, etc. For those women who are, postmenopausal and are focusing on healthy aging. So go to your nearest SYNLAB location and book a Luna test. The Luna test covers all the categories of women age-wise. So to everyone who joined, thank you for being part of this important conversation on women's health. We truly appreciate your engagement. A quick reminder, do not forget to subscribe to our YouTube channel. Follow SYNLAB Nigeria on all social media platforms to stay updated. Today's session will be available on YouTube, so you can revisit it at any time. Finally, before we leave again, please remember to fill the feedback poll to enable us to serve you better. My name is Uchenna Amadi, and it has been my utmost pleasure to host you. I look forward to welcoming you again at our next webinar. Thank you, Dr. Eniola. Thank you, Dr. Waliyat. Thank you, everyone. Bye for now.
Bye-bye.
Your body speaks to you every day in rhythms, signs, and subtle shifts. But are you really listening? Introducing SYNLAB Luna, a personalized women's health experience built to flow with you, because your health journey isn't one size fits all. In your 20s to early 30s, Luna Bloom supports your fertility and reproductive rhythm. In your 30s to early 40s, Luna Align helps you find balance in your hormones and energy. In your mid-40s to 50s, Luna Grace walks with you through the changes of perimenopause and beyond. Over 50, Luna Glow supports your full body wellness for a thriving, vibrant life. Each Luna panel is designed by medical experts to match your life stage, so you get the answers that matter most right now. No confusion, no noise, just clarity, confidence, and care. Visit any SYNLAB Center or book online today. This is more than a test. It's a turning point. SYNLAB Luna. Whole health, every stage, your power. Your body speaks to you every day in rhythms, signs, and subtle shifts. But are you really listening? Introducing SYNLAB Luna, a personalized women's health experience built to flow with you, because your health journey isn't one size fits all. In your 20s to early 30s, Luna Bloom supports your fertility and reproductive rhythm. In your 30s to early 40s, Luna Align helps you find balance in your hormones and energy. In your mid-40s to 50s, Luna Grace walks with you through the changes of perimenopause and beyond. Over 50, Luna Glow supports your full body wellness for a thriving, vibrant life. Each Luna panel is designed by medical experts to match your life stage, so you get the answers that matter most right now. No confusion, no noise, just clarity, confidence, and care. Visit any SYNLAB Center or book online today. This is more than a test. It's a turning point. SYNLAB Luna. Whole health, every stage, your power.